Hi again, I'm Dr. Roger Sohn, a board-certified orthopedic surgeon, and I specialize in the shoulder and arm. In this video, I'll explain how I use hyaluronic acid injections in my practice to treat shoulder and arm conditions. You may have heard of hyaluronic acid before. It's a popular ingredient in the world of beauty and skincare. People get it injected into their hands and their faces, even their lips. But in orthopedics, we use it in a completely different way. Hyaluronic acid is FDA approved for use in knee arthritis. And if you've ever been told that you need a gel shot for your knee, this is what they're talking about. Here's an example of one of the more commonly used versions called Supartz. It's a thick, viscous fluid and its composition is similar to the natural lubricant that's found inside healthy joints. In fact, hyaluronic acid is a key molecule in the cartilage that coats every joint surface. Now, wouldn't it be nice if injecting this stuff into your arthritic shoulder or knee actually grew back lost cartilage? That would be amazing, but unfortunately it doesn't work that way. Hyaluronic acid isn't a regenerative treatment. It won't reverse arthritis or rebuild cartilage. However, it does provide two main benefits. Number one, lubrication. Because this fluid is thick and slippery, it helps cushion the joint and reduces friction. If you imagine an arthritic shoulder joint like being an old creaky hinge, hyaluronic acid is like adding a little WD-40 to make movement smoother. And number two, inflammation reduction. Research has shown that hyaluronic acid blocks the MMP pathway, which is a major inflammatory cascade in arthritis. By slowing this process down, it can help calm down inflammation and reduce pain over time. This is different from the mechanism of commonly used cortisone shots. Hyaluronic acid is injected directly into the joint, usually as a 3-shot series, 1 injection every week, given over 2 to 3 weeks. Some studies have shown that a 3-shot series can provide over a year of relief. In some cases, a second round of injections can extend the relief for another year. However, after multiple rounds, 3 or 4 years down the road, the effectiveness of these injections tends to decline. This is because hyaluronic acid doesn't cure arthritis. It just helps manage the symptoms. Over time, as arthritis progresses, even the best lubricant can only do so much. That said, because it has a better safety profile than cortisone, many patients prefer it for long-term management. Now, while the FDA has approved hyaluronic acid for knee arthritis, many orthopedic surgeons, including myself, use it off-label for other conditions as well. There are two main ways we do this. Number one, for arthritis in other joints. Just because the FDA has approved hyaluronic acid for knees doesn't mean that other joints don't benefit. Many of us use it for shoulders, hips, and elbows. If someone has focal cartilage damage in the shoulder, for example, we often use hyaluronic acid injections to lubricate the joint and reduce inflammation, similar to how natural joint fluid is supposed to work. And number two, for tendon problems. This is an area where hyaluronic acid is gaining a lot of attention. We now know that it can help with rotator cuff pathology and other painful tendon conditions. While cortisone has long been used to treat these conditions, we now recognize that repeated cortisone injections can weaken tendons over time. Hyaluronic acid, on the other hand, provides pain relief and anti-inflammatory effects without the risk of breaking down tissue. It is also commonly paired with PRP, also known as platelet-rich plasma, to enhance healing. PRP provides growth factors while hyaluronic acid acts as a lubricant and anti-inflammatory agent, making the combination a powerful 1-2 punch for joint and tendon injuries. A key difference between hyaluronic acid and cortisone is how quickly they work and how long they last. Cortisone shots often provide fast relief. Patients feel better within a few days, but that relief fades quickly also, usually within a couple of months. And since cortisone can have some undesirable side effects, including cartilage and tendon breakdown, we have to be careful about how often we use it. Hyaluronic acid, on the other hand, takes longer to kick in, usually a few weeks, but it also lasts much longer, often several months to a year. And since it has a better safety profile, we can repeat these injections as often as needed without the same concerns we have with cortisone. So what's the bottom line? Hyaluronic acid injections aren't a magic cure, but they are a valuable tool in managing joint pain, especially for people who don't want to have cortisone injections or if they want to delay surgery. They provide lubrication, reduce inflammation, and can be used to treat damage in joints and tendons. Plus, they can be safely repeated over time without the risks associated with cortisone. As with any treatment, the key is knowing when and how to use it. For some patients, hyaluronic acid alone provides enough relief to keep them active and mobile. For others, it works best as part of a larger treatment plan, often in combination with PRP, physical therapy, or other regenerative treatments. The good news is we now have more options than ever when it comes to treating joint and tendon pain. The more we learn, the better we can tailor treatments to maximize relief and protect joint health so patients can keep moving, keep doing what they love, and stay one step ahead of arthritis. Thanks for watching. If you feel that somebody else might benefit from this information, please feel free to share, like, and subscribe.